What's up? Welcome. If you are new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. Now, in this clinical conversation video, we are answering and asking the question, why are hip shifting exercises important? Now, as I do with all of these videos, I discuss topics that I found that I had frequently throughout the week. And this was one of them. Now, before we jump into it, I want to take a step back and ask you, are you using hip shifting exercises? If you're not, that's fine. But hopefully by the end of this video, you might find that certain people may benefit from it. So how it went down this week is I had a lot of people ask about why they're struggling with hip shifting or when I think they'll get out of pain, and both of them are related. And this is what happened. I told them that when they walk, when they run, when they move, the body is moving and turning like this. And then I went to an analogy that I heard that I thought was really useful, and that was if two people are trying to get to Chicago, and one was in LA and one was in New York, they both would get to Chicago, but they would go different routes. How you're turning, Mr. Jones, is one route or one method. How I want you to turn and when you will be out of pain will be a different route. And you see there's a difference. One has relative motion and one has the ability to dissociate. One is turning in an oriented position or moving as a unit. Both ways are a turn, but not all turns are created equal. When we turn here, when we should be going into internal rotation, if we just turn as a unit, we're not going to be able to do it. And this is why we'll start to see a knee valgus. This is why we'll start to see lumbar extension. What are these mechanisms? These are compensatory internal rotation ways. So, how will I know when someone gets out of pain? When they can start turning the correct way. Because they will start to restore the relative motion that's needed to walk without compensating. If they're not out of pain, they are going to be in a significantly less amount of pain. And so I can say it with a fair amount of confidence. So this is where hip shifting exercises come in. When we do a hip shift exercise, we are trying to restore that relative motion. And that's why it's so critical that when we do it, we're coaching with high standards. Meaning that when I turn to the left, I want them to feel a left adductor, a left hamstring, a left glute. Why? Because this tells me that they're starting to compress one side, expand another, and actually relax. When people just turn as a unit, it's because everything is so compressed. That compression forces a turn with the full body. And so this is why hip shifting exercises are important. They look relatively small. They look like you're not doing much. But when we can start to restore relative motion and get true turning mechanics without compensating for internal rotation, that person is going to be out of pain or living a much better life. So if you aren't using hip shifting exercises, I'd encourage you to start to iterate them for those that you think will benefit. If you're not sure about specific exercises, leave a question in the comments. I'll get back to you as soon as I can. And check out some of the other videos I have because I have a lot of actual hip shifting exercises and kind of walking through. So with that, I hope you found this valuable. If you're in the clinic and you're asked this question, feel free to use some of these. And hopefully that helps your patient understand, and hopefully you can be on a better track to getting your patient out of pain.